My name's Cotter. I work in family medicine at Edmonds. I work as family medicine with obstetrics, so I like to take care of all people in the spectrum. I love meeting pregnant women and going with them through their pregnancy and then delivering their baby and following the baby through their pediatrics and then just taking care of the whole family. So I think that's one of the reasons that I love family medicine is that you can be with people at their birth, but you can also be with people at their death and all the colors in between. So in family medicine, we treat a lot of different conditions. We see a lot of normal, healthy people and making sure that they're up to date. So preventive healthcare is something that we love to do, making sure people are up to date on their PAPs and that they have their breast cancer screening or lung screening, depending on what they need or where they are in life. So I do think it's a hopeful time in medicine. I mean, we're learning a lot more than we've ever learned about health and taking care of people. Obviously, COVID is a part of it, and we've all adapted, and we're all learning things, and there are new vaccines. But I think also just taking care of the person in general, there are new, cancer screenings that we do, or, we've now spaced pap smears out depending on what your results are, so you don't have to come back every year to get your pap smear, which is kind of exciting that we have new technology for that, and there have been vaccines that have really helped reduce that rate. So I think that there's a lot of hope in medicine, and a lot of it is kind of working with your doctor or your provider and figuring out how we can bring hope for you, whether it's you have pain in your low back pain, or if you have high blood pressure and we're trying to get that down, if we're trying to prevent future, heart attacks from happening or strokes. And there's a lot of good medicine, but also a lot of good just wellness things that we can help bring in for people. And I think that's changing every year. We learn a lot more, and it brings me hope to read a bunch of new things about how I can help patients, and so I hope that I can bring that in to get patients feeling good about their care. I love a lot of things about work. I think one of the best parts is the team who's here. We have a lot of really great people caring for all of our patients who come in, whether it's the front desk staff or the MAs or the doctors or the other providers, the people who take images. So there's a really great team, which is very exciting to come in and work for a great team. And then the people who we get to meet. So every day you're meeting some old patients who you know really well, and then some patients that are totally new to you that are coming in with an acute problem that you're trying to help them with. So it's never dull. You're seeing new people all the time, and new things come up even with people that you know well. It makes my day exciting and something new every day. It feels great. It's exciting that we get to celebrate our patients' victories and that we're allowed to play a role in their victories. So, for example, people with diabetes who worked really hard on changing their diet and exercise can really bring down some of those numbers, and so you're treating them with medicines, but they take on a large portion of that themselves by changing what they're eating. We're only with them, half an hour every couple of weeks or months, and so they make a lot of changes on their own, and so it's kind of fun to celebrate victories of patients and that we're allowed to play part of a role in it. So I think being a cheerleader and kind of being there for them and being really supportive, and that lets us play a role in their lives. Yeah, I feel like inspired by patients all the time. Whether it's, the little granny who brought you cookies, who is, excited to meet you and is so glad that she's taking care of you. And she's kind of inspirational because she has arthritis, but she's still making these, old treats for you. The kids who you get to see through their development, and they learn to talk and they're walking, and, development is wonderful, and each person is different, and it's inspiring to just see kind of how that goes. I think in medicine sometimes it's easy to get lost in the weeds with the patient not necessarily being at the top, but that doesn't bring as much joy, I think, to the job when you're working through paperwork or doing other things. It's really when you get to go into, you open that door and go into the room and get to see the patient and learn about them as a person, and not just their list of diagnoses, but what they like to do for fun, what they go out and do for exercise, what their dog's name is. There are all these really interesting parts of being a human, and healthcare is a part of it, but there's a lot more that we don't get to see. So I think trying to keep the patient at the top of the pyramid is learning more about them and really seeing them as a person and not just kind of the list of diagnoses that they come in with. The team approach is great because medicine requires a team to do it. We need all of the I couldn't function without my MA or the front desk staff or everybody working together, and the patients wouldn't get back to see us, there wouldn't be appointments, there wouldn't, and even, the radiologist tech staff or the lab staff, and they come to the room sometimes to draw labs when they're little babies who are very small and you want to send them to, be more exposed than they have to. So I think all of us working as a team help to keep that patient on top because we're doing what's best for the patient and taking care of them rather than focusing on the small details. It is kind of nice to see people as a family and learning what their relationships are and who they're connected with. And that helps me to build a relationship with the patient by learning what's most important to them, which could be family, could be what they do for fun, could be what they do for work. People tell me it's very interesting to delve into people's lives and to get kind of their own story and why they've come here to see you today. So I try to get some of their story, and I feel like that helps me to build a relationship with them. I love to hike outside of work. I really love to bake as well, so I like to just spend some Saturdays making desserts to then bring to people. So, and then I love to read, so any good book recommendations are always helpful and enjoyed.